Hello, this video is going to cover the bone list, upper arm, and pectoral girdle. Please use this list to follow along. The first bone is the clavicle. The clavicle is your S-shaped collarbone. The next bone is your scapula. This is how you spell scapula. First of all, I want you to orient yourself so that you're looking at the posterior side of the bone. There's a big shelf of bone protruding off of a flat bone. That's called the spine of the scapula. So you'll notice above the spine is a flattened depression area that's called the supraspinous fossa. Supra means above, and it's above the spine. So supraspinous fossa. We're going to learn the name of a muscle that lives in that area. Below the spine is the infraspinous fossa. This again is a deep depression that holds a muscle that it has a name that's very similar. This is the infraspinous fossa. We're going to turn the bone, orient the bone so that we're looking head on at the shoulder joint. The area of the scapula that articulates with the humerus is called the glenoid cavity. It's kind of a round, flattened area that articulates with the head of the humerus. The area of bone that protrudes off the spine at the joint is called the acromion. This is not a bone that you need to know the name of. It will articulate with the clavicle. The bone that's on the anterior surface of the bone that protrudes out at the joint is called the coracoid process. And make sure that you orient yourself here so that you're noticing that the acromion is continuous with the spine, whereas the coracoid process is not continuous with the spine. That's how you're not going to get those two confused. Let me show you. When you look at the joint, you'll see that this is the glenoid cavity. This is the coracoid process. The spine of the scapula, the infraspinous fossa. Sorry, that was wrong. That's the supraspinous fossa above the spine. Below the spine is the infraspinous fossa. Moving on to the next bone, which is the humerus. We have a big list to learn on the humerus because there's lots of anatomical features of the humerus. Lots of bumps and grooves. So what I want you to notice first is that the posterior side of the humerus looks an awful lot like the anterior side of the humerus. So you need to figure out how to orient yourself on the bone. If you look down at the distal end of the bone, I'm going to flip it over. So this is the posterior surface of the bone. This is the anterior surface of the bone. The posterior surface of the bone has a very deep depression right here. That's going to articulate with your ulna, and that's going to be your elbow joint, right? So there's a little tiny depression right here, which you won't need to know the name of, but there's a tiny depression on the anterior surface and a very deep depression on the posterior surface. That's how I orient myself with the bone, because the proximal part of the bone looks very similar, although the anterior surface of the bone has a deep depression between two knobby parts right here. And these are going to be names that you'll need to know. So the first thing I want you to do, this part's really easy. This is the head of the humerus. The head of the humerus is going to articulate with the glenoid cavity of the scapula. Those two real knobby parts on the anterior surface of the bone have names that you need to know. There is the lesser tubercle and the greater tubercle. Here's the one that's not labeled. Here's the head of the humerus. Here's the lesser tubercle, which is closer to the head of the humerus, and the greater tubercle, which is more lateral. This is more medial, this is more lateral. And then in between those is a groove where a tendon is going to run from your biceps muscle. That's called the intertubercular sulcus. I'm trying to turn it so you can see that there's a groove right there. So we have the lesser tubercle, the greater tubercle, and the intertubercular sulcus, which is the groove that runs in between those two knobby bones, or between those two knobby parts of the humeral bone. Then we have the deltoid tuberosity. This is a raised area on the bone where you have a big muscle attachment. When a muscle tendon attaches here, it's going to cause some force that pulls against the muscle, and what that does is it causes a ridge of bone. So that's your deltoid tuberosity, and it is just distal to your intertubercular sulcus, right? So that biceps tendon is going to run right past there. Then we're going to go to the end of the bone. So we're on the distal end of the bone, and we're on the anterior surface. We've got two areas on the bone that are prominent. If you feel at your elbow, you're going to feel two kind of a medial bone or a medial part of a bone and a lateral part of the bone that are knobby on the surface of your elbow. So here it is on the unlabeled bone. So you have the side that is continuous with the head of the humerus, which is the medial epicondyle. And then you have the side that is continuous with the greater tubercle. So that's on the lateral side of the humerus. And it's also on the same side as the deltoid tuberosity. So that is your lateral epicondyle. So those are those 2 points of bone that you feel at your elbow. Okay, then we have this little kind of a bubble of bone right here. It's called the capitulum. The capitulum is going to articulate with your radius right here. And the trochlea is going to articulate with your ulna. So the trochlea is a flattened, kind of a smooth surface, and that's where the hinge joint is made with your ulna. So let me show it to you on the unlabeled bone. That's called the trochlea. That makes up the hinge joint of your elbow. Now I'm going to turn to the posterior side of the bone, and you're going to see this deep depression. This is called the olecranon fossa. The olecranon fossa is going to articulate with the top part of the olecranon, which is called the olecranon process. So it's going to go right, it's going to fit right in there, and that's going to make up your hinge joint. So that's what that olecranon fossa and the trochlea look like. Okay, moving on, we go to the radius. The radius is made up of the head. That's the part of the radius that I said kind of looks like a Smartie. Then we have the radial tuberosity. It's a large, prominent area on the bone where a muscle attaches. So we have the head of the radius, the radial tuberosity. Then down at the bottom of the radius, we have a styloid process, which is if you feel your wrist, and at your wrist there's going to be a prominent point of palpation on the lateral surface of your wrist. That's called your styloid process. It's going to be below your thumb. So we have the head, the radial tuberosity, and the point at the end of the radius is called the styloid process. We're going to go to the ulna. Okay, so this is our unlabeled ulna. Remember I said the ulna has, at the proximal end of the bone, has like a U, so it tells you it's the ulna that's going to make up the hinge joint with your elbow. At the top, the most proximal part of the ulna, we have the olecranon process, The olecranon process is at the top of the U. In the middle of the U is the trochlear notch. That's going to articulate with the trochlea, which makes up the hinge joint of the elbow. And at the bottom of the trochlea is the coronoid process, not to be confused with the coracoid process on the scapula, right? At the lower part of the ulna, we have the styloid process, which is a little blip of bone. Let me show it to you on the unlabeled, because the label is covering it up there. That little end right here is the styloid process. And then the head of the ulna is at the distal surface. So that's kind of confusing, but the head of the ulna is at the distal surface. It's right here. So we have the olecranon process, we have the trochlear notch, we have the coracoid process, we have the styloid process, and we have the head of the ulna. Moving on to the hand and the wrist bones. Remember, the wrist bones are the carpal bones, the hand bones are the metacarpal bones, and the phalanges are the finger bones. So we have the carpals, the metacarpals, and the phalanges. That ends our video. Hope that helps. Have a good day.